Good afternoon to everyone present here. I am Sanjana. I am a 5th year PharmD student from the Department of Clinical Pharmacy. I am here to present a case report on combined dexamethasone and cyproheptadine abuse. So to begin with, cyproheptadine is a prescription first generation antihistamine with additional anti-serotonergic and anticholinergic properties. So this drug is primarily used to treat allergy symptoms, and it has an off-label use as an appetite stimulant and also for treating conditions like migraine and serotonin syndrome. So how this works is that cyproheptadine blocks the action of histamine and serotonin receptors in the body. So this mechanism relieves the allergy symptoms, and by acting on the feeding center in the hypothalamus, it also stimulates appetite. So the feeding center in the hypothalamus is mainly the lateral hypothalamus. So this is the brain region that controls the drive to eat. So stimulation of this region increases the food uptake, while damage to it can cause loss of appetite. So, however, this drug is widely used over the counter as a weight gain agent, especially in India and other lower middle income countries. So this has raised concerns of abuse and dependence. So some of the common side effects include sedation, dry mouth, constipation, restlessness, dizziness and excitability. So common cyproheptadine brands in India include Ciplactin, Practin, Peritol and Aptimust. So when it comes to dexamethasone, so dexamethasone is a potent long-acting corticosteroid medication which is used to treat a wide range of conditions by reducing the inflammation and by suppressing the immune system. So this is available in various forms such as oral tablets and also liquid solutions and injections. So this dexamethasone is used clinically in conditions such as RA, asthma, bronchospasm, idiopathic thrombocytic purpura, cerebral edema, adrenal insufficiency and other autoimmune illnesses. So this dexamethasone is also often abused for appetite stimulation and for weight gain in low and middle income nations, and it is particularly abused by young people and women who want to look more attractive. So as a result, the chronic abuse can lead to a compromised immune system, then psychiatric manifestations like depression, anxiety and suicidal thoughts, and also metabolic disorders like diabetes, hypertension, osteoporosis, and also Cushingoid features like round moon-shaped face, and then thin fragile skin that bruises easily, and also muscle weakness. So some of the common brand names for dexamethasone in India is Dexona, Decmax, and Demisol and Dexam. So although either of these drugs is not meant to be sold as an over-the-counter medications in India, many Indian pharmacies do sell it as an over-the-counter medication, and also many people obtain these drugs without prescription. So people often rely on recommendations from their friends, peers, relatives, and in some cases even beauticians, especially for topical steroid creams. So rather than relying on recommendations from a qualified doctor, so because of this, it leads to non-physician sourced acquisition of such medications. And also certain people want to gain weight for various reasons such as certain medical conditions and for their recovery needs or for building muscle mass. But misuse often happens in those individuals who are influenced by societal or peer pressure to look more attractive. So in these cases, the motivation is cosmetic rather than medical, and due to which there is an increased risk for inappropriate or unsafe use of these medications. So coming to the case, this case is that of a 25-year-old male patient holding a BA degree and belonging to the middle socio-economic status with recently this patient was unemployed. he was referred from the general medicine department to the psychiatry. So he had presented with symptoms of sadness, lack of activity, weakness, loss of appetite, and has admitted the over-the-counter use of medications for weight gain. So this patient initially started taking a tablet Dexamethasone 0.5 mg twice daily and tablet Cyproheptadine 4 mg twice daily, and had started consuming these medications back in 2020, and this was for his weight gain to address his self-perceived lean physique. So he had admitted that a college friend had influenced this consumption of medications. So during this time when he was consuming the medications, he experienced increased hunger and sleep. And he would say that he would feel so hungry that during college lectures, he wouldn't be able to focus in class and he couldn't wait until lunch break. And so this continuous pattern of hunger eventually made him take the medications on and off. So initially he had taken the drugs continuously for 3 months, due to which he gained significant weight. So as you can see, he was initially 32 kgs and then the weight, he nearly gained 25 kgs. So he was almost 55 kgs when he took the drugs continuously for 3 months. So once he gained enough weight, his parents asked him to discontinue taking the medication. But however, this cessation also resulted in a rebound decrease in appetite and weight loss, and this caused him further anxiety. So again, after a month, he restarted the drugs, but this time he was doing it intermittently to manage his weight. So this patient initially presented to the general medicine department, so upon which he was counseled and then he was put on a weaning dose of dexamethasone. And again, on the follow-up, there were still complaints of continuous loss of appetite and generalized weakness. So at this point of time, his weight had reduced from 55 kgs to 42 kgs. So again, further weaning of dexamethasone was done. And then also fasting serum cortisol was done to assess the HPA axis suppression. And later, tablet prednisolone 30 mg was added after the serum cortisol report. And this was done to manage his withdrawal symptoms. So apart from this, the patient had also told that he had constant worry about his body image, and he would often think whether others would comment negatively about his body. So because of which he would sleep way past midnight, and he would only wake up pretty late during the day, around 9 or 10 a.m. And this used to happen every single day. So when it comes to his social and occupational functioning, it was significantly impaired as he was unemployed for the past month. So he would always sit at home most of the time scrolling on his phone, and he would always avoid going out with his friends. So when it comes to the family history of this patient, his father has a history of alcohol dependence syndrome. So upon presenting to the psychiatry department, a Hamilton Depression Rating Scale assessment was done on this patient, and the score came out to be 22, which indicates mild depression. So finally the diagnosis was made as corticosteroid abuse with mild depression. So he was then started on tablet olanzapine 2.5 mg to manage his mood symptoms, and vortioxetine was also added 5 mg to manage his depressive features. So again, during a follow-up, the dosages of these two drugs were optimized, and apart from this, the patient was also provided additional psychosocial intervention, which highlights the need for a holistic approach to address his social and occupational challenges. So when discussion, so steroid misuse is definitely a recognized problem in India, but no large-scale surveys have been done which focus on corticosteroid misuse for weight gain. So many of these studies are mostly dermatology-based, focusing on topical steroid creams and not on oral corticosteroids for weight gain. So this rarity of cyproheptadine dexamethasone misuse is maybe attributed to the significant underreporting of these cases, as individuals themselves often do not disclose non-prescribed or cosmetic use of such medications. So these are some of the other reported cases in India. So there was a report from Kashmir which talks about a 20-year-old male aspirant who developed obsessive compulsive symptoms and suicidal behavior within a week of using cyproheptadine and dexamethasone for bodybuilding. And upon cessation, his symptoms resolved entirely. Another case report from 2019 describes a man who gained 15 kg of weight during a 1-year period while consuming cyproheptadine and dexamethasone, which was illicitly prescribed by his gym instructor. And there was another study in Kerala which recorded a 0.63% prevalence of systemic glucocorticoid misuse. So it was mainly prednisolone, dexamethasone and hydrocortisone, which was often obtained through pharmacies and was used for a prolonged period of time. Also in North Bihar, the prevalence percent, which highlights regional disparities. So when it comes to the global scenario for misuse of these medications, in Africa, the prevalence in the Democratic Republic of Congo was up to 59% in specific local populations, where they have reported misuse of cyproheptadine and dexamethasone. But among this, it was mainly young women seeking enhanced beauty. And the vast majority of these populations itself obtain these drugs by self-prescription, which tells us that there is a lack of regulatory control in such countries. And in Iraq, almost 37% of young adults misuse dexamethasone for weight gain, and the majority of these were women. And also in countries like Yemen, Iraq and Iran, herbal weight gain products were adulterated with cyproheptadine and dexamethasone, and these were often in high or unlabeled doses. So these were also consumed by people there. So although neither of these drugs have a high addictive potential, so their combined misuse for weight gain may result in dependence and also cause serious adverse effects, especially when it's stopped all of a sudden. And in this patient, he wanted to address his rather lean physique. So that is why he obtained the drug upon influence from his friend, and he did not consume it with the intention of abusing the drug itself. So key takeaways, when such drugs are self-prescribed, there is always a chance that the person may take the medications for purposes that is usually self-perceived and mostly for not indicated categories of health. And consumption will always, in such cases, be more than the minimal dose and duration. So either they may consume it unknowingly or they may consume it to attain faster and better results. So hence the risk for side effects is always high, as in this case. So always managing corticosteroid abuse requires coordinated care to address the medical complications, to address the psychiatric impact, and also to address the medical related issues together. So all contributing to optimal care for such patients. So these are few of the references that I have used for this case. Thank you, sir.
Nice case.